Good day everyone. My name is Ivan Nicostales from BSN 1C, and today I'm going to transfer a patient from the bed to a stretcher. So first, let's assemble the equipment. Transport stretcher, friction reducing sheet, and lateral assist device such as transfer board, roller board, or mechanical lateral assist device if available. And next, bath blanket and regular blanket and at least two assistants depending on the patient's condition, and non-sterile gloves or other PPEs as indicated. So next, implementation, review the medical record and nursing plan of care for conditions that may influence the patient's ability to move or to be positioned, and assess for tubes, for lines and incisions or equipments that may after the positioning procedure, and identify any movement limitations, and of course perform hand hygiene and put on PPEs if indicated. So next is identify the patient and explain the procedure to the patient and introduce yourself. So, good day sir, my name is Ivan Costales. Ako po yung magiging nurse niyo today. And ano pong pangalan niyo sir? And ang gagawin ko lang po ngayon is lumumog ko po kayo from bed to stretcher. Kaya lang po yan. Thank you. And next, close curtains around bed and close the door of the room for the patient's privacy. And next, place the bath blanket over the patient and remove the top covers from underneath. So next is, if a friction reducing transfer sheet is not in place under the patient, place one under the patient's midsection and have patient fold arms against chest and move chin to chest, and use the friction reducing sheet to move the patient to the side of the bed where the stretcher will be placed. Okay. And next is to alternately place a lateral assist device under the patient and follow manufacturer's directions for use. And position the stretcher next to and parallel to the bed and lock the wheels on the stretcher and the bed. And two nurses should stand on the stretcher side of the bed. But yung sa amin po is one nurse na lang po yung lead kasi malit lang naman po yung patient namin. Okay, so next, use the friction reducing sheet to roll the patient away from the stretcher and place the transfer board across the space between the stretcher and the bed, and partially under the patient, roll the patient onto his or her back so that the patient is partially on the transfer board. And The nurse on the side of the bed without the stretcher should grasp the friction-reducing sheet at the head and chest areas of the patient, and one nurse on the stretcher side of the bed should grasp the friction-reducing sheet at the head and chest, and the other nurse at the chest and leg areas of the patient. And at a signal given by one of the nurse, have the nurse standing on the stretcher side of this bed pull the friction reducing sheet. At the same time, the nurse or nurses on the other side push, transferring the patient's weight towards the transfer board and pushing the patient bed to the stretcher. One, two, three, go. So, once the patient is transferred to the stretcher, remove the transfer board and secure the patient until the side rail are raised. And raise the side rails to ensure the patient's comfort and cover the patient with blanket and remove the bath blanket from underneath. And leave the friction reducing sheet in place for the return transfer. So, next, clean transfer aids per facility policy, and if not indicated for single patient use, remove gloves and any other PPEs. If used, perform hand hygiene. So next, for evaluation, the expected outcome is met when the patient is transferred to the stretcher without injury to patient or to nurse. And for the documentations, document the time and the method of transport and the patient's destination. And according to facility policy, document the use of transfer aids and the number of staff required for transfer. So, that's all po.